Piya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
G'day and Swadee Kub. Well, we were very, very lucky to have Dr. Piya from Bangkok Pattaya Hospital here, a heart specialist. You exactly describe as electrocardio specialist, is that right?
Yes. I'm a cardiac electrophysiologist.
Electrophysiology. So I cannot recommend his talk strongly enough for you to get an overview of heart issues and heart treatments. So today is World Hypertension Day. So hypertension is one of the things that can lead to heart issues.
Yes, hypertension is one cause of the cardiac arrhythmia.
And cardiac arrhythmia, that can be a small thing, but it can be a very, very big thing.
Yes, correct. It can be harmless, that you do not need any treatment, or even serious that can cause you suddenly death or cardiac arrest.
So it's very varied. So this is why this talk was so comprehensive and brilliant. So I might have an occasional, once every couple of months, have a but that's nothing to worry about.
First, you have to check that is what the symptom you got is, what type of the arrhythmia. First, you have to know diagnosis. Depend on the type of the arrhythmia. Some arrhythmia is okay if something that is not causing any symptom, but if they have some, like the atrial fibrillation, you may have to treatment.
Yes, so that's another interesting thing, because there is a great variety of different treatments depending on your level of problems with your arrhythmia.
Yes, it depends on the diagnosis and what type of the arrhythmia.
So you should start by talking to your general practitioner if you experience arrhythmia.
Yes.
And then, of course, he might recommend you on to a specialist, etc. One of the things that came up was the drug warfarin, which a lot of people, they swear by this drug. Is that used for diabetes as well, warfarin?
Warfarin can use in the patient who have diabetic, but warfarin when you use, you have to come for regular check for the level at a good level. It's normally about between 2 to 3. If the level is too high, your blood is too thin, you may have the problem with the easily bleeding. Or even if your blood is too low, it's not prevent any blood clot.
So it's quite a tricky drug.
Yes, it's quite one of the difficult drug to control.
I had a friend who swear by it. He thought it should be in the water supply. So there's a new generation of drugs that are better than the warfarin?
Yes, right now we have the new drug that we call NOAC or DOAC. NOAC is there are 4 types of the drug that you can use at the fixed dose, and you no need to come for regular check the level. And this drug is the less drug interaction and less cause of the bleeding if you use at the optimal dose.
Interesting. So that's interesting. Warfarin's been sort of superseded. So what are some of the simple things that people can do if they think, oh, I only have a little bit of arrhythmia, I can just change my lifestyle? What sort of lifestyle changes can they make?
Okay, the lifestyle is you have to limit your first. One of the cause of the arrhythmia is alcohol. Too much caffeine. You have to limit the amount of the alcohol, not take too much. And if you can stop smoking, it can prevent the arrhythmia. You have to control the high blood pressure at the optimum level, control the blood sugar. And if you have the problem with the sleep apnea, you better treat it.
Sleep apnea is a very, very serious problem. Do they have a sleep assessment center in the hospital?
Yes, we have a sleep test. In the one who have suspect sleep apnea, they can book for the queue for the sleep test.
Yeah, I had one friend there, and he actually had a test, sleep test, and he had problems with restless leg syndrome. So that was really, he didn't have sleep apnea, but sleep apnea, it can be a life-threatening problem.
Yes, sleep apnea is one of the cause of the high blood pressure and one of the cause of the arrhythmia.
Yeah, it could be serious. Could cause a lot of serious things. So I wanted to thank the doctor again for just doing a wonderful, wonderful job. You really want to watch this talk. It's really informative, really comprehensive, and really thank you, Dr. Piya. And I can see one of our members has already transferred to you.
Thank you so much. Thank you for let me the opportunity to talking today.
It was a wonderful talk, and get your blood pressure checked. It's World Hypertension Day. Stay well.